there are other muscles that connect to the shoulder. There are actually 17. It's quite a few. And a few important ones that I want to point out right now, and that's because when we talk about the stability of the shoulder, the rotator cuff and the long head of the biceps tendon all come into play. But what holds? So that's basically what's keeping the ball in the socket. Okay, we know that the shoulder is more than just a ball and socket. This is maybe the primary joint. However, we also have a joint connecting up here, which is important. We have a joint connecting here, which you don't see the sternum. You can see it on Homer here. The clavicle connects to the sternum. That's a really important joint. In fact, if the clavicle were to dislocate from the sternum, you'd have no function of your arm. And that's because the only true bony connection for the arm is through the collarbone, where it connects to the body. The only true connection of the arm to the rest of the body is through the joint of the sternoclavicular joint. But there's more to it than that. What I want to talk about now is the muscles that help control the stability of the shoulder blade. The shoulder blade relies on muscles that help it move forward and backwards, upwards and downwards. It even rotates. So when we shrug our shoulders up, we have a set of muscles that will be active. And those muscles, if we look on the back of Homer, they're going to be located on the top here of the shoulder blade. The upper trapezius is one of those muscles, and the levator scapula is another. So these muscles are going to be connecting all the way. The upper trap will connect up to the back of the skull, through the ligament on the back of the neck, along the side of the upper neck and shoulder, to the clavicle, the scapula, okay? And it's going to be one of those muscles that when you go to reach for something, it wants to help. And we know in therapy that when a person is trying to recover shoulder and arm movement, the upper trapezius muscle may be a compensating muscle. So it's good that we know when to use it appropriately, but we also are paying attention at how to not let it take over when we want other important shoulder blade muscles to work. The levator scapula is going to be attaching towards the upper part of the scapula, as the name sounds, and then it's going to be connecting onto the upper outer part of the neck. So again, those are the shrugging muscles. Maybe if you balance a phone on the side of your ear and your shoulder, you're going to be using the levator scapula and the upper trapezius muscles. Some other important muscles of the shoulder blade include the rhomboid minor, which is going to be attaching on the upper part of the scapula and attaching again towards the spine. And then just below that is going to be a bigger part of the rhomboid. It's called the rhomboid major. So again, this one will be a little bit further down and then attaching up towards the spine. So you'll have two muscles that are basically side by side. Now the rhomboid muscles are going to be helping you pull your shoulder blades backwards. Pulling your shoulder blades backwards corrects so many posture issues, but it also creates better stability for the ball and socket of the shoulder. Then we also have not just the upper trapezius that goes in this direction, but we have the middle trapezius. The trapezius is a trapezoid shape, and that's how it gets its name. And so if I outline it here on Homer, the upper trapezius will make up this part of the diamond shape, and then the middle trapezius will just be the middle part, and then you can see here the lower trapezius will make up the final portion. So we have almost like a triangle, and then on the other side another triangle. So when you put it together, it's this oblong square, diamond shape, or trapezoid. So the middle trapezius fibers also help pull the shoulder blades back together, correcting posture. They work slightly different than the rhomboids, and that's because of the angle. So the rhomboids might be having a fiber orientation in this direction, and then the middle trapezius will have a fiber orientation in this direction. And then the lower trapezius will have a fiber orientation in this direction. So the lower trapezius muscles are also helpful for pulling the shoulder blades back and down. Down it is one of the most important motions that people should generally work on, whether you're injured or not, because it is often forgotten. The other cool thing about that lower trapezius muscle is that it helps when your arm is overhead. And that's because, remember I said how that shoulder sometimes it likes to help out by lifting up that upper trapezius? Well, if I raise my arm up and my shoulder comes up too, then that's the muscle I'm going to be using more of. If the shoulder stays down, then that means I'm using more of the lower trapezius muscle. And that's very important to achieve full range of motion and optimal stabilization of the scapula on the rib cage and the thoracic spine during overhead activities, whether it's throwing, climbing, reaching, and again, it's an underworked muscle for the general population as well as the injured shoulder. Homer's been very helpful. We're going to go through a couple more muscles that are important for shoulder stabilization. So there's a muscle underneath the arm, and it's going to be connecting onto the outside, middle, and upper ribs and connecting on the undersurface of the scapula, all the way on the medial side towards the spine. This is called the serratus anterior. The serratus anterior, we'll look from this position with this model, it's going to be attaching all the way over here. So this is the outside of the right arm, and this is the shoulder blade. It's going to be on the inside, front side, and on the inside, medial border, and then connecting around to the ribs. Now what happens with this is that when the ribs, if my fingers represent the ribs here, then when that muscle activates, it's going to pull the shoulder blade forward. Pull the shoulder blade forward. Now, that might sound like something you don't want to do, but in fact, the balance between the functional protraction or forward moving of that shoulder blade is very important, and especially when we're raising our arm up, the tracking of the shoulder blade is partially getting directed by the activity of that serratus anterior. So we'll see the motion pushing forward like this. If I pull back, that's using my rhomboid and middle trapezius muscles primarily, and when I push forward, it's using my serratus anterior, and I can feel that working underneath my, basically under my arm here along the ribs. Now again, I'll have some other muscles like the pectoralis minor trying to help out, but that muscle underneath here helps when I'm raising my arm up overhead. And in fact, there are a couple exercises to work just on that area by raising your arm up overhead against resistance.